Doctor, if you look at the countries and you looked at across the globe, so many of them, which ones have done well and which one have not done well? Now, India is a developing country. We don't have the resources and the financial cushion that the West has. Give us a couple of, tools that India should use and implement, and a couple of things that India should not do, must not do.
Well, I think the most important lesson we've seen is to try to contain the virus as much as possible and keep numbers low, because it's exponential growth and it's much easier to be in a position where you're dealing with dozens of cases or hundreds of cases than if you're dealing with hundreds of thousands of cases. And that's a lesson from countries like South Korea, Australia, New Zealand, who have managed to keep their numbers quite low. It's still a challenge for them, but I think one clear lesson is containment is very important. I think another lesson is to build diagnostic capacity. Yeah.
Sorry, you said containment. I just wanted just a little more description on how do you do that containment? How do you suggest?
Containment by just actually testing, tracing those individuals and putting them into quarantine. And so actually just trying to manage the number of people who are affected by this virus. I think a second lesson is about diagnostic capacity. South Korea knew from its experience with MERS that actually lab capacity to really ramp up testing capacity and the number of contact tracers, the number of community outreach. And I guess the third tied lesson to that is actually the importance of a decentralized response, that this is about local communities, this is about local governments, and actually making sure that even if it's centrally coordinated and overseen, that actually there's local response and that they have, local accountability and responsibility. I'd say things not to do. One is, I think it's quite dangerous to spend too long in lockdown. Lockdowns have been seen as a solution in terms of you can rapidly reduce the rate of transmission, but lockdowns are very costly socially and economically, and so every day in lockdown has to be used quite valuably to actually try to aggressively go after the virus. I think another one is just to try to buy time for a scientific solution, because it'll be science which really gets us out of this kind of global crisis.
Right. I guess buying time is important because, as a developing country, you don't have so many doctors and facilities that the West has. But what is the alternative to a lockdown, and how do we get out of it? What are your thoughts on that?
Yeah, exactly. But that's why I say I think lockdown was probably essential to get a handle on it, but using that time, because one of the benefits of lockdown is the number of of contacts one person has seems to reduce, right? From, more than 20, maybe more than 50 to actually less than 10. And so if you actually want to do, aggressive testing, if you want to do surveillance to understand in the country which populations have, higher transmission, I think this is the time to do it. So lockdown basically is like freezing time or putting kind of, pause on this rate of transmission of the virus while you implement other measures. And so the time should just be used as much as possible to aggressively go after the virus.
Let me just ask you about one controversial recommendation which has been suggested and then they've been kind of redacted or not exactly accepted, is that in a lockdown, when you lift it eventually, you should still carry on with people 60 and above still being in lockdown, and no lockdown for people under 60. Does that make sense, or are there problems with that because the younger people will go out and then come back, perhaps, especially in a country like India, the joint families come back and interact with people over 60?
Yeah, so this is being discussed in a number of countries, the idea of shielding certain vulnerable populations. And I guess at a conceptual level, it makes sense. But the thing I guess I worry about also is how much can you shield these individuals, because you have multi-generational households. You often have, elderly people living with children, with their grandkids, or with family members. And so in a perfect world, if we could, find a way to do this. And the second thing I think is interesting talking to elderly people is many of them say actually it's very important for them socially to see other people, and that loneliness and social isolation is also not without a cost. So I think that has to be weighed, not first in terms of, is it pragmatic? Can you do it? And the second is, actually, do those people even want that as a possible solution for them? They have to be listened to as well.
Yeah.